So the Phase III CARTITUDE-4 study is a randomized study exploring cilta-cel and comparing cilta-cel, a BCMA targeting agent, versus standard of care treatment for patients with relapsed refractory myeloma, refractory to lenalidomide after 1 to 3 prior lines of therapy. And the primary results of this study were presented at the last ASCO and EHA meeting and were published in New England Journal of Medicine, where the progression-free survival, which was the primary endpoint of the study, was met. And at this ASH meeting, we have presented the analysis of patient-reported outcomes of patients that were enrolled in the CARTITUDE-4 study at a median follow-up of 15.9 months. So investigators administer PROs to patients that were enrolled in the study at different time points, baseline, and then throughout the study every 3 months, and then up to month 24. And the PROs used were the EORTC Quality of Life Questionnaire, which is a cancer-specific questionnaire assessing global health status and then symptoms and functioning domains. Then the Euro Quality of Life Questionnaire including a visual analog scale where patients self-rate their health, and then a MySim questionnaire, which is a myeloma disease-related questionnaire, which was specifically designed in patients with multiple myeloma, assessing several symptoms and items related to multiple myeloma. So what we found out was that the patients in the cilta-cel arm reported a greater improvement in their global health status score, defined by the EORTC Quality of Life Questionnaire, meaning that patient in the cilta-cel arm experienced a greater improvement in their general health. Patient also reported a greater improvement as compared to patient treated in the standard of care arm in terms of emotional functioning, but also social, role, and physical functioning, meaning that patient reported to feel less stressed, less irritable, less depressed during the study as compared to patient in the standard of care arm, in which neither of these items actually improved. When patients were asked also to self-rate their health through the visual analog scale, we observed greater scores, greater improvement in terms of self-rated health for patients in the cilta-cel arm, when at month 12, the improvement reached a clinically meaningful improvement as compared to the standard of care arm patient, which who did not report a overall improvement. That the PRO values remained basically similar to the values at baseline. And also we investigated pain and fatigue, and there was an improvement in pain for both treatment arms, cilta-cel and the standard of care, but the improvement was greater in terms of pain in the cilta-cel arm. This improvement was very quick to occur at month 3 already, and kept and remained constant throughout the follow-up at month 12. And importantly, there was an improvement also in fatigue for cilta-cel, while we did not observe any significant changes in the fatigue scores for patients in the standard of care arm. And a greater proportion of patients in the cilta-cel arm reported a significant, meaningful improvement from baseline in terms of both pain and fatigue as compared to patient in the standard of care arm. And eventually also in terms of myeloma-related symptoms and impacts, we observed an improvement in the cilta-cel arm, while in both domains, in symptoms and impacts, we did not observe a significant improvement for patient in the standard of care arm. And eventually the time to symptoms worsening, sustained symptom worsening, was longer in the cilta-cel arm, and this is consistent with the longer progression-free survival reported already in the primary analysis as compared to the time to symptom worsening in the standard of care arm. So altogether, this results in which patient reported a greater global health status improvement, a greater improvement in the self-rated through the visual analog scale, a greater improvement in terms of emotional functioning, but also physical, social, and emotional functioning, an improvement also in pain, in fatigue, and in symptoms related to multiple myeloma, along with the PFS benefit, the benefit in terms of response rates and MRD negativity rates already reported in the primary analysis. Altogether, these results reinforce the potential role for cilta-cel to be a new standard of care in patients with lenalidomide-refractory multiple myeloma after at least 1 prior line of therapy.